Welcome to the presentation on assignment and delegation of tasks for UCPs. I am Sandra Helena, the Regional Knowledge Coordinator for Home Support Transformation. And before we begin, I would like to recognize and acknowledge that we are collectively gathered on the traditional, ancestral, and unceded territories of the 7 Interior Region First Nations. This region is also home to 15 chartered Métis communities, and it is with humility that we continue to strengthen our relationships with First Nation, Métis, and Inuit people across the interior. So our learning objectives for today are that you should be able to explain your role and responsibilities when it comes to performing a delegation of task for a client. Be aware that the DOT standard procedures that will be in the home binders may look different going forward, as they will be completed and printed in the Meditech system. And of course, you should be able to read and interpret the new version of the DOT in order to provide the appropriate care to your clients. So I want to give you some background on what changes are happening. Delegation of task has been identified as an area of risk for interior health, and our current resource tools are outdated. So we have updated the information and resources for the delegating clinicians, which will benefit you as well. We are making updates in order to support our home support transformation goals of transitioning from paper to electronic tools, and creating easier access and clarity to the required information for both clinicians and unregulated care providers. In Interior Health, we now have a delegation of tasks standard procedure document that describes the roles and responsibilities of everyone involved in the process of delegation. This includes the RN, consulting clinicians, service providers, and those who deliver the care, such as yourselves. So let's take a look at the role of the unregulated care providers. So as a UCP, you are responsible and accountable to know what tasks you can perform through assignment. Only perform a DOT if it is authorized and you have the appropriate training. Complete the delegation as instructed on the standard procedure. Seek assistance from your team leader, home support, or adult day service coordinator if you are unsure how to perform the task. And report changes in the client condition to the clinicians. So starting in June, you will begin to see some different types of DOT standard procedure forms in the home binders. This is the updated downtime or paper form, and it has a few minor changes from the current ones. So let's take a look at the revised form. It will, of course, indicate who you need to report your observations to and a list of things that you might report. The supply section has been moved up in the document. The medication section will now have a place for the name, strength, and other information specific to the type of medication. Client-specific instructions is now under the medication section before the procedure directions begin. And the second page, of course, remains the same with the procedure steps listed. This is what the delegation standard procedure form will look like when it is printed from Meditech. You can expect to see both types of forms in client homes over the next several months as clinicians start to transition their current clients to the electronic versions and as new clients are admitted to the program. You can see it has the same headings as the paper copy. Observations to report and who to report them to, supplies and where they are located, medication information, and client-specific instructions. The procedure section, of course, remains on the second page. Starting around the end of June and into July, you will see the new Meditech electronic DOTs, as well as the new and old downtime forms in the home binder. We will also be working on having the electronic versions available for CHWs to view on the cell phones, but that most likely will not occur until 2023. If you have any questions, please contact your home support team leader or adult day services coordinator. If you are unable to connect with them, then you can contact any other person on the slide. Thank you so much for listening to this presentation.